Capstone and 5-year plan. Hello everyone, I'm Shanee Robinson and I've been a registered nurse for about a year and a half. After obtaining my degree and license, I made the decision to enroll into Lamar's RN to BSN program. Later on that year, I began working as a private duty nurse at a pediatric home health agency. After about a year of doing pediatric home health, I decided to move to the bedside, and I currently work on the mother-baby or postpartum unit at Texas Children's Hospital here in Houston. While working at TCH, I've obtained my neonatal resuscitation certification, my stable certification, and will receive my PAL certification early next year. Stay tuned as I explain how I've achieved Lamar University's baccalaureate student learning outcomes. First outcome, lifespan health continuum. Support patient-client in preventing disease, maintaining wellness, promoting and restoring health and advocacy for death and dignity. So the classes I've completed this outcome was comprehensive holistic health assessment through the shadow health simulations, care of patients with compromised multiple health steps, which was a practical one assignment where we had to interview someone with a disease process and kind of go into detail about it. So I was able to, reach out of my comfort zone and interview different people, especially in my community and care of communities. And I've maintained this outcome through the windshield survey, community resource project we had to do, and a disaster teaching plan. Patient-client centered care. Objective: employ safe, effective patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interpersonal or intrapersonal healthcare team. So again, this objective was met through my comprehensive class through the shadow health simulations. It was met also through the nursing theories and online education class, where we had a nurse philosophy paper where we had to explain what our nursing philosophy was. It was met through the leadership and management in the healthcare system class. We had a clinical applications paper we had to do. Again, the care of patients with compromised health states, which was the practical one I explained in the last slide, and also the community-based service learning activity PowerPoint, which is a PowerPoint we got to do. I also got to interview another close friend of mine with a disease process and do a PowerPoint on her and, reach out to different community resources about her care. And then care of the communities was also the windshield survey, the disaster teaching plan, and again, the community and resource and shelter project. Humanity and society. Objective: practice safe and effective holistic patient-centered care to a variety of patient clients in multiple settings from a global perspective by incorporating theories and evidence-based practice. This objective was met in the care of communities through the disaster teaching plan and also the windshield survey. Through the care of patient in compromised health states, also again with practical one assignment where we had to interview a patient with a disease process, and with that it was compared to the disease process of a person in like a memoir we had to read. So we read a memoir before the assignment, and then we had to find someone with that same disease process and interview them. It was also met in the leadership and management in healthcare through our global health PowerPoint that we had to do. Also through the nursing theories and online education, again, the nurse philosophy paper and the comprehensive holistic health assessment. So those shadow health simulations, they tailored to the whole nursing program. So that really helped out a lot. Objective and professional roles. Demonstrate professional integrity, effective communication, active inquiry, and service to the community. So this comes with care of patients with the compromised multiple health states, which was the community-based service learning activity, which was the PowerPoint, and practicum number 1. From care and communities, which was the disaster teaching plan, leadership and management in the healthcare system, which came from the clinical application paper, and effective leadership and qualities paper. And also, again, the comprehensive holistic health assessment, which comes from those simulations. Evidence-based practice and clinical reasoning. Synthesizes clinical reasoning and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. So these come from the nursing inquiry and evidence-based practice class. So we have to do a quantitative research article and also critique a qualitative research article. And that class kind of helped with being more familiar with searching different databases and, trying to tailor to, specific criteria for what you're looking for. It also comes from the nursing theories and online education. So this was a personal paradigm cases. It was like a discussion board where we had to explain how something in healthcare or an experience we had during healthcare kind of changed how we practice. Again, the comprehensive health assessment was the simulations again, and leadership and management in the healthcare system. So this was the clinical application paper, the effective leadership and qualities paper. Lifespan health continuum. So the next objective is evaluates patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. So it comes from the care of patients with compromised health states class was practical 1 assignment and the community-based service learning activity that we had to do. The comprehensive holistic health assessment, which was the simulations, and care for communities, which was the disaster teaching plan. Professional roles. Differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients or clients as a member of the interpersonal or interpersonal healthcare team. So it comes from comprehensive health assessment class, the nursing theories and online education class, leadership and management in the healthcare system class, the care of patients with compromised health states, and the care of communities. So I believe that's almost all the classes except for 2. And my career plans, my 5-year career learning plans. So within the next 5 years, I actually plan to get my master's in nursing. I'm not sure if I want to go to education or if I want to tailor to a family nurse practitioner. I know there are many options out there, so I have time to decide, but that is on my goals list. I also want to try to be a travel nurse. So far, postpartum has been really good. So if I can travel as a postpartum nurse to different states, that would be great. And I have on here start my own business. Since I've taken the community class and worked home health, I've been kind of tailored to starting like a community center or just like another community health center in the in the surrounding areas, or starting a business as a home health nurse, independent, and probably grow from there. Thanks for listening to my PowerPoint. I hope you enjoyed. I believe I have excelled in these learning objectives, and I look forward to graduating with my bachelor's degree in December. Thank you.